Hello, I'm Jurgen Unutzer. I'm a psychiatrist and health services researcher. I'm also a professor and vice chair of psychiatry at the University of Washington, and I'm here today at the Institute of Psychiatric Services in New York City. And we've been talking about a concept called integrated care, or also called collaborative care. This is an effort to bring together psychiatrists and primary care providers to work together in a more integrated, more collaborative way to take care of the large number of patients who are seen in primary care settings but not seen by a psychiatrist. In fact, if you look at research, only about 1 in 10 Americans who live with a mental disorder will see a psychiatrist in any given year, and many more are seen in primary care by their primary care providers. Because we don't have enough psychiatrists, and sometimes patients don't want to go to see a psychiatrist, they are more comfortable with their primary care doctor. So we have developed over about a 20-year period, both in research and now in practice, an approach called collaborative care, where we find a patient in a primary care clinic and we train a team member in the primary care doctor's office to function as a behavioral health care manager who works alongside the primary care doctor to take care of a panel of patients with mental health problems. And each of these teams has appointed to it a consulting psychiatrist. And the role of that consulting psychiatrist is a little bit different from what they would normally do in traditional office-based practice. That consulting psychiatrist will meet once a week with the care manager working in the primary care clinic and review in a systematic way a caseload of patients who are being followed for things like depression or anxiety or possibly a substance abuse problem in a primary care clinic, and they will make treatment recommendations to the primary care provider in a systematic way on those patients who are not improving. They may occasionally say, this is too complex, I don't really know what's going on here, I'm not comfortable making a recommendation, I would like to see the patient in consultation. And we have done that in different ways. We have provided those as traditional consultations, either the psychiatrist coming to the primary care clinic and seeing the patient there, or the patient going to the psychiatrist's office. And where I'm from, in the state of Washington, we have a lot of very rural primary care practices that have very poor access to psychiatry, and so we can often use telemedicine, so a tele-video connection between the psychiatrist's office and the primary care clinic to provide a consultation like that. And what we have learned over the years from a large number of research studies, that when you provide that kind of care where a psychiatrist works closely, collaborates closely with a primary care clinic, a psychiatrist can reach a much larger number of patients than they could in traditional office-based practice. And we can help our colleagues in primary care make a big difference and improve the lives of patients that they're seeing in their practices.